Hello, this is Dr. Hobson. This week's blog will be concerning headaches. My patients asked me if I could discuss the cause and effect of headaches and perhaps how to prevent headaches. Good ergonomic things that you can do that you unknowingly are causing the headaches. So if we can teach you how to prevent those and teach you the cause and effect, I think we can go a long way in getting rid of your headaches in a more permanent fashion. First of all, the cervical spine is composed of seven vertebrae. We call them cervical. The cervical spine has a series of muscles that attach to the back of it that allow the spine to have extension, a series of muscles that attach to the front of it that allow the spine to have flexion. And it has a series of nerves that come from the spine called cervical nerves. There's a cervical plexus and a brachial plexus, which I'll describe further in just a moment. So I want to show you some of the charts on my wall here to further explain how the neck works. The neck is supposed to be finely balanced. So the center of gravity of your head is supposed to be right over the center of your torso. It should be balanced while you're driving a car, while you're sleeping in bed, while you're at your desk working or watching television or whatever you're doing. It should remain neutral. This is appearing from the lateral view. The head should also be neutral as appeared from the front to back or posterior or anterior view. When the neck is neutral, it has the least amount of force on it. When the head begins to flex, forces begin to summate and build up in the cervical spine. At the vertebral prominence, or C7, the forces in the front of the anterior vertebrae here can be as much as 270 pounds of summative force. But when the head is balanced in a neutral position, the force is only the normal weight of a human head, which is 12 to 15 pounds. Holding the head in flexion on a regular basis puts tremendous stress into the neck. It starts to create physical stress and irritation to the posterior cervical muscles, causing them to start to compress and tighten up, causing the joints to start to compress and tighten. And over time, it leads to chronic tension buildup, totally preventable by maintaining good ergonomic posture as you go throughout your day. When the head is also bent forward, it begins to put excessive stress on the spinal nerves. In fact, it puts compressive and irritable stress on the brain stem, which is the medulla oblongata in the pons. The way that it does that, as you bend forward, it actually tractions your spine up a little bit. There's three coverings for the brain and the spinal cord called meninges: the dura mater, the arachnoid membrane, and the pia mater. The pia mater actually attaches by way of little denticulate ligaments to the actual spinal cord and to the brain. And so when the spine moves, it actually tractions those nerves. When the spine bends forward, it actually starts to physically compress little blood vessels that come up through the spine called the vertebral arteries. And as these blood vessels get compressed and irritated, it starts to reduce circulation to the neurological system. With prolonged flexion of the neck, it actually will lead to disturbance of your nervous system. It not only will cause headaches through irritation of the muscles here, the temporalis, the frontalis, the occipitalis muscles. That's what creates the type of stress headaches we're talking about. And most headaches are vertebrogenic, which means they're caused by mechanical stress and irritation in the neck. Now, we can do stretches of the neck, and we can do stretches of the muscles of the upper back, and we can get massages. We can even get injections into the neck. We can take pills to try to manage the pain. But what I'm going to be teaching you today is how to prevent the pains from ever starting in the first place, which will, in long term, let you get rid of your headaches. So let me show you some of the common problems and ergonomic mistakes that people commonly make, which I'll go to my chair here to explain that. So people commonly work as they work, they commonly bend their head down like this. They're working with keyboards. They're sometimes looking up. They're looking down a lot. And really the neck should not be looking down more than just a few seconds at a time. Your work needs to be up in front of you. If you have a mouse and a keyboard and a screen, you really should be looking straight ahead at that screen with the screen at eye level. The back of your chair should be upright so that your neck stays neutral position, like I explained earlier. It's when you lean back and you lean your head forward and you look down a lot, which so many of our citizens do, that actually is what's causing your headache. So I want to teach you how to have better ergonomics by sitting up straight. And we want you to do this with your pillows as you sleep at night. The pillow should start here and not here. Pillows starting here will push your head forward. Pillows starting here will allow your head to drop back into your bed. Sitting in your car, your seat in your car should not be leaned back as you drive. The seat in your car should be more upright so your neck, again, is allowed to stay in neutral position. So there's a number of stretches that I want to explain to you that I think you can start working on along with these ergonomic changes. One of the simple exercises I prescribe and recommend to patients is a pure lateral flexion stretch where you stretch your neck and your upper back. You simply hold for 5 seconds and then you go the opposite direction. Neck and upper back, hold for 5 seconds and repeat that 5 times. Then you rotate your neck, looking as far as you can to one side, rotating your upper back. When you reach end position, hold for 5 seconds, come back to neutral, and then the opposite. As far as you can, neck and then upper back, hold 5 seconds, and repeat that 5 times. The last 2 is you take your neck forward and your upper back forward, hold for 5 seconds, and then you take your neck and upper back backwards, hold for 5 seconds. You'll notice that that complete set of stretches took me about 1 minute or less, maybe 30 seconds to complete. Those stretches should be done really throughout the day, because things that you do unknowingly where you're stressing your neck is tightening stuff up. I want you to stop that. When you use your tech, like you're going to be looking at a smartphone, don't look down at it. Get your smartphone up in front of you so that your neck can stay in the neutral position. Put pillows or whatever you need in your lap to get that tech up in front of you so you're not looking down at it. And then throughout the day, you might feel your neck and upper back tightening a little bit. Just stop and do those stretches 3 times a day. There's a number of other things that a bent neck can do. It can cause brainstem problems. As you traction that brainstem, it can start to affect your heartbeat. It can start to cause dizziness. It can cause brain fog. It can cause numerous other types of vascular-related headaches. So I want our followers to start practicing these techniques, maintaining good ergonomics throughout your day. And doing some of these simple stretches, I think you're going to be very surprised that your headaches are going to start to naturally fade away without any other types of treatments. So start working on this. Until next time, this is Dr. Hobson, hoping that you can take control of your health and start doing some proactive things with your life that can prevent these problems before they get started. Thank you.